did want to point out that you have that information for your stories. Okay, perfect. I'm sorry, we will take questions at the end, so that obviously our speakers are medical professionals, so they do need to get back to their patients.
Good morning. My name is Dr. Margo Ernie. I'm Medical Director of Summit County Public Health. And we called you here today because we wanted to get some information about an incident that's going on. Summit County Public Health was notified of a confirmed case of tuberculosis, pulmonary tuberculosis, in a Summit County resident on January 3rd, 2017. In the course of our standard tuberculosis investigation, we worked with the case to identify persons who are potentially exposed to the case who would benefit from an evaluation and testing. The case stated that in November and December 2016, they had visited the neonatal intensive care unit at Summa Akron City Hospital. Summit County Public Health communicated this information to Summa Akron City Hospital and Akron Children's Hospital that operates the neonatal intensive care unit. The three organizations have worked collaboratively together to identify contacts associated with the neonatal intensive care unit who might have been exposed to the case and arrange for evaluation and testing. These contacts include infants, visitors, and staff. Akron Children's Hospital has personally notified families. While the risk of acquiring tuberculosis is not high, Summit County Public Health, Akron Children's Hospital, and Summa Health System agreed that it was prudent to notify the contacts for evaluation and testing, and in the case of infants, prescribing preventive medicine for a certain period of time. Akron Children's is taking care of the infants and the visitors to the NICU who have been identified and notified can be tested by their primary care physician or by calling Summit County Public Health at 330-375-2772 to schedule an appointment. We are recommending that testing be done in 6 weeks from now, because if a person were exposed and infected, it takes 10 to 12 weeks for the body to respond to the tuberculosis bacteria. It's important to state that persons who were notified or potentially exposed are not contagious or can pass anything on to others. The case did not know they were infected with a communicable disease at the time the visits were made. There is no known relationship between this case and any other tuberculosis cases that have been previously identified in Summit County. The case is on treatment and is doing well, and there's no risk to the general public or persons who have not been previously identified or notified. As per Summit County Public Health policy, case confidentiality is vital, and we will be not sharing any specific characteristics of the case because they are irrelevant to the exposure. There is a frequently asked questions on the Summit County Public Health website, and people can check out that site for more information. And I'm going to turn it over to Dr. Bauer to give some of the Akron Children's Hospital perspective.
Well, good morning. I'm Dr. John Bauer at Akron Children's Hospital, pediatric infectious disease specialist. And several things to clarify as we start. First of all, what's the association between Akron Children's and Summa? Important distinction. This involves the neonatal intensive care unit at Akron Children, which is located in Summa's hospital, Summa Healthcare System Hospital. This does not involve the intensive care unit on our main campus at Akron Children's Hospital. As we talk about where we are right now with this investigation, we certainly want to look at our patients and see what risks there might be. What's our approach? Our approach is really to take advantage of the electronic medical record. Here we have something that allows us with a great deal of accuracy to determine what patients were in the unit and for how long during the times where there may have been a potential exposure. This allows us then to compare these two lists, the exposure times as well as the admission or time in the NICU to decide who is at risk. And we're taking a cautious approach to this. We're being, we're giving everyone the benefit of the doubt and making sure we have the broadest scope of examination and make sure that we identify everybody that is potentially at risk. As we do so, one of the things we ask ourselves is what's the risk? And we have experience, not here necessarily, but when we talk about nationally, this is an unusual event. To have a tuberculosis within a neonatal intensive care unit, unusual, but not unique. experience not only in the United States, we also see experience in Europe, United Kingdom, and we've had opportunities for people to report on these experiences, so we have some idea what to expect. And one of the things we can expect is, thankfully, a low risk of actually becoming infected. The small risk of infection, though, is not a zero risk of infection, and that's the difference. And why is a low risk, even a low risk of infection, of concern to us? Is because the nature of the patients being exposed, young infants. Because one thing about tuberculosis is the risk of complications, that's what we're looking at. The risk of complications is higher in young children, especially infants. So what we want to do is make sure that we have an opportunity to look at all the potential exposures, assess their risk, and then we move from there, and we've asked patients to come and see us so that we have an opportunity to evaluate, to review all the information, to get the family's input, to make sure that we have all the information accurate, and then we can, based on that, decide do we need to initiate treatment for protection of the child, and certainly to talk about subsequent testing. So that's where we are in terms of our evaluation right now. We're in the process of that, making sure that we have an opportunity to evaluate every single person that is at risk for exposure. We continue to examine and go through our electronic medical record to make sure we have indeed captured everybody, but thus far we seem to have identified all of the potential risks. When we talk about where we are right now, a couple things that's just important to reiterate. One is these patients do not pose, anyone exposed to this particular case does not pose a risk to others. So anyone who is in that neonatal intensive care unit, Akron Children's Unit at SUMA, does not pose a risk to anyone else out in the community. Nor is the nursery at Akron or at SUMA Hospital at risk, because these are separate units. So no risk to any babies that were in the nursery at this time. So again, just important to remember, this does not pose a high risk to other people. What our major risk of concern is for the individuals who may have been exposed, and making sure we eliminate or mitigate any risk there. And I will conclude with that, and then we'll open up for further comments. Yes?
Are you releasing the age of the person who was infected? Do we know if it's an adult, a child?
No.
Yeah. What we are doing right now is we're certainly releasing any information that's relevant to the case investigation that there is a need for the public to know. But any other information we're keeping confidential. And one thing to keep in mind is tuberculosis, as Dr. Ermey said, can be something that you simply don't realize you have. And so an individual can have the infection, be contagious, and simply not know it.
Can you say why the individual was at the hospital? I mean, visiting a patient or working there, or?
It's a member of the community who was visiting, but not a hospital employee or healthcare worker. Yes.
Can you explain again what you were saying, that anyone exposed to this particular case does not pose a risk out in the community? But you were also saying, where did you go on to say there?
Yes, that any patient who was exposed poses no risk to anyone else. That's the simple answer.
But then you were saying within the unit.
But within the unit, we want to examine our patients there. So babies who may have been within the unit could have been exposed, and we want to make sure they're not at risk.
Outside of the hospital situation, does the investigation involve dealing with other individuals who may have come in contact with that person who was affected?
When we do a standard tuberculosis investigation, we always look for contacts, because we don't look for people who might have been exposed, but we also look for other people who might have infected the case as well, because they would have had to pick it up from someplace else. So yes, we look at other contacts as well. We do that with every single case.
Originally, you had said between, I think, November, December 2016, but because of this electronic medical record, don't you have the precise date or dates that it might have happened?
Yes, we do.
But you're still sticking with November or December 2016?
That's correct. The people who need to, as Dr. Bauer said, we're able to hone it down to very specific people. The thing is this was not a continuous exposure because the person visited during that time frame. But again, because these are high-risk infants, and even though the risk is low but not zero, we are being very prudent.
How many people is that?
Yeah. Our number is around 50 that have potentially been exposed.
Both in the hospital and individually with this particular person? No.
50 potential exposures within the neonatal intensive care unit at Children's Zuma.
The release says the Akron Children's has begun notifying the families, but they've all already been notified, is that?
Most of the families have been notified. Obviously, it's, there are certain eventualities that arise. We can't reach them immediately. We've left messages, but the notifications are ongoing. But most of the families have been notified, and we're in the process of evaluating those families.
How many?
I do want to say those 50 are the infants. They're not looking at all the any other adult visitors or staff. So we are working on those numbers now.
So at this point, everyone who is possibly exposed has been identified, just maybe not tracked down yet.
That's correct.
Is that correct?
And as I said, we want to be careful, so we're continuing to review our record just to make sure. So we'll continue to look, but right now that seems to be the number, and all of them have been identified and notified, or in the process of being notified.
Is there anything you had to do in particular with the unit as far as disinfecting it or cleaning it after the fact, or?
Hi, I'm Jimmy Abel, and I'm infection prevention in Sume Health System. And we deal with all of these infection prevention and control issues all the time, and they're fairly standardized. TB is primarily an airborne mechanism. So when you're close to a person who has TB and sneezes, you may inhale their organism. Once the organism falls to the ground or falls to a surface, there is no way for it to be inhaled by another person and represents no risk. So that was a long way of telling you that standard terminal cleaning is done for these cases.
How many TB cases are diagnosed in Summit County every year? I mean,
So in 2012, or 2016, we had 12 tuberculosis cases, and we are currently following 8. For treatment for tuberculosis, it takes anywhere from 6 months to 9 months to longer, so that's why they may extend over a period of a year. But we had 12 new cases identified in 2016. And that was actually less than we had in 2015.
Of the 8 that you said you're still following, was this visitor to the NICU, was this visitor one of those 8?
This case was identified January 3rd, so yes, that will be a part of the 8. Any other questions? If not, we want to thank you for coming, and people can be referred to the frequently asked questions on our website. I believe it's also on Children's website.
It's included in their press.
And it's included in your packet, so thank you.